So David, when did you come to Washington?
I figured we might start there since we both have been here long enough. I began in September of 1983 in the Senate.
So right about the time that government shutdowns became kind of a thing.
Yes.
So in
And
the sort
and
of
the real showdown between Congress and the president really started to erupt constantly.
Yeah, and I know there was some legal rulings too that basically opened the door in terms of the ability for there to be a shutdown. I don't want to get too much into it. We've talked a lot about how the federal fiscal year begins on October 1st, and if there's not finalized appropriations for all the different agencies, then there is the possibility of a shutdown. That's something that's happened, more than 20 times since you came to Washington. And so I know it's
No,
something.
no causal connection at all.
Yeah, no, two totally separate things. But I thought, when I sort of think about it, they tend to fall into two categories. There's either the day or two, or sometimes for a few hours, where they're close to reaching an agreement. They can't quite get it over the finish line. The government shuts down, and then the agreement's finalized, and there's not a huge impact. We're already a couple of days into this shutdown, and it feels like this is the other kind where, it could be for an extended period of time. Is that your sense as well?
Absolutely.
So, it's impossible for us to predict the future, but as we, anticipate that this is a shutdown that may be one of the longer ones, it could go 10, 20, even 30 days. So, David, maybe we should talk about the agencies that are most important to ASN members and to the more than 37 million Americans with kidney diseases. Around the Department of Health and Human Services, big picture, can you give us a sense as to how a shutdown will affect HHS?
About 32,000 people will be furloughed, 79,000 or 80,000 will be retained. And that's the immediate. If it goes too long, it may change. But at the moment, that's what we're seeing for HHS.
Okay, and then within HHS, maybe to just focus on a couple of agencies. So, Centers for Medicare and Medicaid Services, do you have a sense as to what the impact will be for CMS?
CMS is going to be probably one of the places that has the smaller impact. They are going to be keeping 53% of their staffers. But a lot of things also are contracted out, and a lot of things are going to be continued to go. So that they're not going to necessarily um, do everything. They won't be doing a lot of the reviewing and a lot of the monitoring of various programs, but they will not stop those programs. And so you'll probably not see a lot of delay. And payments, CMS has made it very clear in the last couple of days that they are well taken care of for Medicare for the rest of the year, and I mean, for the rest of this calendar year, and that Medicaid they are even ready for through the first quarter of next year. So you're not going to see a lapse of payments.
Yeah, so I guess we should have started by talking about essential versus non-essential. It's obviously in the eye of the beholder, but something like food inspections with the FDA, that would be essential. Perhaps some of the reviews of drugs that are being considered for approval, those may be slowed. I know at NIH, there's some interesting things because obviously they want to keep the clinical center open, but you can imagine a lot of administrative staff will probably be furloughed. I know in the past there's been discussion because the people responsible for keeping the animal labs open and the animals alive, they are deemed essential. So a lot of what we're doing here is trying to figure out how the agency and then how the administration defines essential versus non-essential.
Lauren, you want to comment about that the food inspection? You had some thoughts about that earlier today.
So, the HHS contingency staffing plan makes it clear that staff whose work directly impacts human life are considered essential and will continue working during the shutdown. This includes activities like food and drug inspections, as well as efforts to address issues such as drug shortages or outbreaks of foodborne illness. This also connects to your earlier point that you made about the National Institutes of Health. According to the plan, about 2,000 NIH staff will remain on duty to provide direct medical services in service unit facilities and clinics, supporting both medical and pharmaceutical care of the patients that are currently admitted there. The vast majority of these staff will be at the NIH Clinical Center up the road in Bethesda, Maryland. It is important to note, though, however, that while the clinical center will stay operational, it won't be accepting new admissions during the shutdown.
Thank you. That helps a whole lot for people to know that. That's really important. Todd, where do you want to go next?
So I'm curious about the CDC. I mean, the Centers for Disease Control and Prevention, that's been a um, bit of a fight between the administration and Congress and then the broader community. My sense is that's an agency that may be really vulnerable at this moment in time. Curious as if you have information as to what's likely to happen there.
Well, what has been reported, and Lauren, if you've got some other things in the contingency plan, please let us know. What has been reported is that they will furlough 8,700 staff. Of those 8,700 staff, 1,500 of them will be RIFs. They'll be reduction in force. So those people will not return.
Yeah, so that's an aspect of this shutdown that I don't remember from previous ones where the
Nor do I.
administration, yeah, that the administration's using this as an opportunity to eliminate positions as they sort of revisit Doge's goals. Um, are there other kind of health care centric agencies that you think might get riffed?
I think everybody, if this goes long enough, the word from people I know from the White House is, if this goes long enough, um, the rifts will be pretty much spread across the entire government. They fully want to make sure that there's a long-term goal about kind of reshaping the government, and so they are going to use this. And like you said, I do not recall, if I'm incorrect, I'll just say that right now, my apologies, but I do not recall using rifts in this way in the other shutdowns.
Lauren, what about the Department of Veterans Affairs? Do you have a sense as to how the VA is going to be affected?
Yeah, so the VA for the most part has been declared pretty much completely essential. So thankfully they're going to retain about 97% of their employees. So they will continue to provide many of the services that they already do.
So it's interesting because it seems like, at least from a nephrology perspective, there's variability here, and there'll be some agencies like CDC that are going to be affected much more than others like the VA or CMS. Maybe if we shift gears a little bit, I know, David, you were on a panel recently with the American Nephrology Nurses Association talking about policy issues, and one of the questions around the shutdown related to the effect on all the changes to transplant policy. Curious as to your sense as to how the shutdown will affect, what's happening in transplant.
Sure, Todd. Now, this information that I have gathered from people who work very closely as transplant nephrologists with HRSA and with OPTN. Their expectations are, as transplant nephrologists and kind of experts in the field, not kind of really big experts in the field, but there is so much contracting in that system. The contracting would not be affected, and they don't really expect anything like of to really kind of set that off. I asked very specifically, would anything interrupt deceased donation? And they were like, no. So that's kind of where we are on that one. I think that one is kind of set off in its own way.
And Lauren, I know you've looked a little bit at what's happening at the VA with its transplant programs. I would assume, given what you said earlier about the VA not being affected as much, that transplant at the VA should be okay.
Yes, transplant with the VA will still continue.
Okay. So, David, maybe to close, we could talk a little bit about what this is likely to do from an economic perspective. So, in my experience, every government shutdown results in some sort of slowing of the economy. A lot of the economic data was starting to point negatively for the president and for the Republicans who are in control of Congress. And we are about a year out from a mid-year election. We do have a number of important state elections that are coming up. Do you have a sense as to if this were to continue and be one of the longer shutdowns, how that would affect the economy and therefore the sort of political dynamic here?
I think it's pretty clear in some ways. The polling has shown for some time that a good portion of the United States is very concerned about kind of where we are. And I don't mean like Republican or Democrats. It's kind of like where we are economically, where we may be going. And one of the things that's going to be odd is in a couple weeks, the Bureau of Labor Statistics should be coming out with its reports on labor, on hiring, on jobs. The agency is not expected to do that during the shutdown. So you could get to a point where later in October, the markets are saying, we don't even know where we are. We don't know where we are on jobs. We don't know where we are hiring. And that could have a chilling effect. And it doesn't take much of a chilling effect for businesses to start not planning and not thinking about things. Because after you get through October, one of the things that you are looking at is one of the biggest consumer spending periods of the year around the holidays. So the faster this gets taken care of, the better it will be for the American economy, in my opinion.
All right, David. Well, thanks. Lauren, I want to give you the last word. My guess is this is your first government shutdown, at least as a person in the labor force. Curious as to your reaction to it.
I actually do have very strong memories from the last government shutdown in 2019 and the impact that that had on my community because many of the people in my hometown work for the government as well through a Navy base. It was really interesting. But it's really interesting actually being in Washington, D.C. and seeing the impact firsthand.
All right. Well, thanks, Lauren, and thanks, David, and we will talk soon.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.